is Lindsay, and I'll be nutrition counseling to my patient, Lauren, today. Okay, Lauren, so to get started, we're going to talk a little bit about your daily habits and everything you do in your daily life, okay?
Okay.
So can you start out with telling me what you do on a daily basis, like how you start your day, what you start just eating or anything else, like what you do when you wake up in the morning?
My day's normally kind of hectic. I skip breakfast a lot of times. I'm not real big on, eggs and stuff like that. So I have to get myself and my kid ready to get out the door on time. So it's just kind of busy. I'm a student and a mom, so just don't have a lot of time for food.
On a different note beside you, do you make sure he gets something to eat before you leave? Like, what kind of, do you give him grab-and-go food? Do you normally grab something with him? Like, along those lines?
He does eat breakfast. I normally sit him down and he eats while I'm getting ready for the day, so, he could probably eat better too, but he really likes toast with peanut butter. We do juices, milks, cereals sometimes, just depends on the day.
Okay. So along the lines of vitamins, do you take any vitamins or any supplements, anything like that?
I currently take a prenatal vitamin because I'm 6 months pregnant. It has DHA and folic acid in it. It's just like one a day.
Okay. Does it have anything like iron or calcium or anything like that?
Yeah, it has all of that in it too.
Okay, awesome. So a little bit about do you know anything about nutrition? Do you know what normally you should eat every day? Do you just stray away from it with your hectic lifestyle?
I know what I should be eating, but I'm probably not doing that so well. I'm not a vegetable person, and I'm kind of lactose intolerant, so I avoid the dairy products too sometimes.
Okay, so a big thing especially even because you're pregnant, so we want to maintain not just health in your overall body, but especially in your mouth as well, because us being hygienists want to start everything in the mouth. So digestion actually starts in the mouth, so that's a big thing as well. So we want to make sure we eat foods that are non-acidic. We want to make sure we're stimulating the saliva in our mouth as well, and making sure that we are supplying our whole body with needs, not just our mouth as well.
Okay.
So on the notes of your lifestyle, you are married, as you said.
Right.
So do you meal prep? Do you make dinner ahead of time while you're at school? What do you normally do on a typical basis?
It really just depends on the day. Sometimes we go out to eat if it's a really, hectic day. Other times I do cook when I get home from school. We normally have a meat of some sort. We're big chicken eaters. He likes salmon, but I'm not a fish person, so I'll cook him salmon sometimes. Pastas. I'm trying to think what else. I don't know. Lots of I make sure there's a vegetable, but of course I don't eat it. So I just want it there for my son to be able to eat.
Yeah.
Sometimes I do meal prep on Sundays if I have the time, if there's not too much homework and assignments due the next day. So it just really depends from week to week.
Yeah, that is really good. Sometimes with busy, hectic schedules, even crock pot meals are really easy.
Mm-hmm.
So you could throw in some pork, roast, let it sit all day, and then whenever you get home, just throw in a vegetable. I know you don't like vegetables, so we'll touch on that later, what we can do instead. But even just meal prepping, making a couple options throughout the week instead of, you don't always have to put them in the containers like everyone typically meal preps. But just to make some chicken on the grill, make enough for the whole week, you can grab and go, throw it on salads, throw it on sandwiches, all sorts of different options as well.
Cool.
Do you have any questions so far?
Not yet.
Okay, so that concludes section 1 of our nutrition counseling video.